It's been 11 weeks since I had the surgery for the basal CMC arthritis in the joint thingy. And I'm doing pretty well. So I have some lingering pain that's just annoying. Everybody's different. And I've been going to occupational therapy 2 times a week. So I just want to give you a follow-up. Instead of doing my doctor appointment right around the 12-week mark, which is normal, I was going to do it a week before in the 11 week because that would be before the end of the calendar year, just to keep all the insurance stuff in one calendar year. But then the doctor was gone that week, so I had the appointment right at about 10.5 weeks after surgery. So he looked at it, he thought it was doing well, x-rays looked good. You know, he was like pulling it and yanking it and, and it didn't hurt. So that's not what hurt. He thought that was doing really well. And then I had also been to the dermatologist the week before and they thought that the skin was healing well. I'm still have some, not bloating, you know, what's it called? Yeah, I'll put the word over here because I'm having a senior moment again. But it's not hard. It's soft tissue. It's just bigger than normal still. So I'm not wearing the brace anymore. The SPLINT. I'm not wearing the Comfort Cool thing anymore either. At the end there, maybe around 9 or 10 weeks, I was still wearing that once in a while, like when I was sleeping, when I walked the dog, when I was going to and from the car, just to protect it. But other than that, I would take it off at work, I would take it off at home, and just give my hand a break. So still doing a lot of the exercises. We added more strengthening with little weights around, I don't know, the 8th week. I think that's when we started. And the other thing we started working on is with putty, with strengthening. But before I want to tell you about this other scar. So we're always focused on this scar, but we forget about this scar where they cut my arm to snip the tendon. And it was, I called it the belly button in my arm just because of how it moved, and it was just gross. So the occupational therapist put a piece of kinesio tape on it for a few days, and a few days later it just looked so much better, just the way it was moving. Even though I massaged it in there, just because of the scar tissue underneath, it was just weird. It wouldn't move at all, you know, like the rest of my skin would move. So that is getting better, and it doesn't hurt at all. So the pain that I have is not so much at the surface anymore. I get pain deep inside, and I get an achiness in the fleshy part of my hand. So it does feel good to massage that. The OT told me just don't do it really hard. Even though I would like to massage it kind of hard. She just said don't do that. But she works and massages my whole hand, which I need to do that more often. And I need to do the exercises, most of them twice a day, some of them once a day. But I am loving the putty. So the putty comes in different strengths, and when it's at the weakest, it looks like silly putty. It's the beige is yeah, the weakest. So I've actually moved up. You know, they told me to spend a minute doing this with it, but I have a stronger, harder piece of putty to do that now. Now what I'm doing with this is some pinching motions. So pinching with it on a table just to get this motion going, and also twisting like this again just to get this pinching motion going. I am doing better in other exercises. Like 2 weeks ago in an exercise where she had me doing this and then 2 and 3 and 4, I could only do 1 and 2. 3 was just way too hard. And then she got me doing 3, but I couldn't do 4. It just hurt too much. And they don't want us to do anything that's painful, like do it until pain. So anyway, now I can do this. And then the next two colors in the putty are yellow and then orange. And she said that most people say that the yellow doesn't feel any different to them than the beige. So she mixed some yellow and orange, which has now become orange. So it's a little tougher, but it feels really good in my hand. I'm really liking this. I've also started doing some upper body weights at the gym, and she told me I was doing too much on my left side, so I needed to cut back, even though to the arm it felt fine. It's just to the hand, she's like, yeah, that's too much. So this feels really good. So then as it turns out, I actually work for the company that makes this putty, and so that I didn't have to bring it to work every day, I asked one of the people in marketing, do we have any of this you can give me? And she took me into the, what I call the marketing toy closet, and they had some that was in purple, and I brought it to show my OT yesterday, and she said, oh my gosh, we should get that. And it's called Progressive. So it starts off being just like the beige, but then they have these purple chips. And if I put one chip in it, it'll be like the next step up, the yellow. If I put another chip in it. So I've actually put one chip in it, and it just sat there at first like a chip inside putty, but then it kind of oozed and melted and incorporated itself. So now I can't find that chip in here anymore. So I take this one to work and leave it there, but I have it at home because I brought it to occupational therapy yesterday with the chips, because I think they could probably save money by buying this and giving this to patients instead of this. So this they use, like, well, she'll take a whole pile of putty and put it on the table and pull a piece off, and I'm pulling off like big chunks of it. So they use it for other reasons. So I'm really loving that. So I've just passed 11 weeks. I'm not even at 12 weeks. I'm not even at 3 months. I'll be at 3 months on January 5th, 2018. So of course I want to be done with this. I want to be back to doing everything. There's still certain things that I just can't do, like picking up my heavy leather jacket. I can't do that with this hand. I can't pick up the dog with this hand. She's just too squiggly and wiggly. I can button, except for pants that side zip and have a button. That button's a little hard to do, but I can do all those kinds of things now. I think I can do snaps, but I have a couple snaps on my leather jacket, but I think I use this hand. I do it so fast I don't even think about it. But she told me this week to think about things that I'm having a hard time doing, where I just don't bother doing it because I know it's too hard, and I use my right hand just so we can work on those kinds of things. So they are going to take me into doing OT through January. So that means, so October 5th is when I had the surgery. So 4 weeks of no OT, because that's when I was in the cast and all that. And then so November, December, January. So I'm doing another month of OT that I didn't expect to do. So it's taking me into the new year with a brand new, insurance and everything. So if I had to do it over again, I'd probably do the surgery in either mid-August to mid-September, in that month time frame, or earlier, just to get everything all in one calendar year. But other than that, it's going really well. For those of you who are thinking about having this done, I highly recommend it. And as people told me, do it when you're younger. Don't wait. Just get it done. The younger we are, the faster we heal. So someday I'll do the right hand. I know it's going to be so much harder because there's so many things I do with my right hand. Check out some of my other videos by clicking one of the images on the right side of your screen, or mouse over the upper right hand corner. You'll see a little eye. Click that and you'll see other videos related to this, including the playlist that has all the videos about this surgery. Thanks for watching. Bye.